Did you know that ignoring or disregarding a concussion can put young athletes at risk for serious long term issues? Hi, I'm Dr. Jason Hahn, Sports Clinical Specialist. Today, I'm going to help bust 5 of the most common myths about concussions in youth sports so you can better protect your athletes and loved ones. Myth number 1: you have to lose consciousness for it to be a concussion. Let's start with this one because it's probably the most widespread myth. The truth: most concussions do not involve a loss of consciousness. A concussion occurs when the brain moves rapidly inside the skull after a hit to the head or to the body. The sudden movement disrupts brain function, and you don't have to be knocked out for that to happen. In fact, studies show that only about 10% of concussions involve losing consciousness. Just because a player didn't black out doesn't mean they're okay. If you're suspecting a concussion, look for other symptoms like headaches, dizziness, confusion, sensitivity to light or sound. If in doubt, sit them out. It's always better to play it safe. Myth number 2: if you don't hit your head, you can't get a concussion. Here's a big one: you don't need a direct blow to the head to suffer a concussion. A hit to the body, like a hard tackle in football, a collision in soccer, or even a fall, can send enough force through the body to make the brain move inside the skull. Think of it like whiplash. If your head jerks back and forth quickly enough, your brain can still be injured even without direct impact. To my parents and coaches, anytime there's a significant impact, don't assume that the absence of a head hit means there's no concussion risk. Watch for symptoms and seek help if needed. Myth number 3: if you don't have symptoms right away, you're fine. This is another dangerous misconception. Concussion symptoms don't always show up immediately. Sometimes symptoms appear hours or even days after the initial impact. A young athlete might say, "I'm fine," and they feel fine right after the injury, only to develop headaches, confusion, or irritability later on. This delayed onset is one reason why athletes should be closely monitored for at least 24 to 48 hours after any potential concussion. I will say that again: 24 to 48 hours after a potential concussion. Here are my tips for parents and coaches. Keep checking in with your athlete. If they start to complain of new symptoms, no matter how mild, make sure they get evaluated. Myth number 4: you just need to tough it out and get back into the game. This mindset has to stop. Concussions are not injuries you can just push through. The brain needs rest to heal. Trying to tough it out or return to play too soon can lead to prolonged symptoms like headaches, dizziness, and trouble focusing. Second impact syndrome, a rare but life-threatening condition where a second injury happens before the brain heals from the first one. As parents and coaches, I know how hard it is to keep an eager athlete here on the sidelines. They love their sport, and we love watching them play, but rushing them back puts their future at risk. Remember, a short period of rest now can prevent months or even years of recovery later on. Myth number 5: concussions aren't a big deal. Finally, let's tackle this myth head on. Concussions are a big deal, especially for kids and teens. Their brains are still growing and developing, which makes them more vulnerable to injury. An untreated concussion can impact their ability to concentrate and excel in school, regulate their mood and their emotions, and recover fully for sports and life activities. And here's the reality: repeated concussions over time can lead to chronic issues like persistent headaches, learning difficulties, and even long-term brain disorders. Protecting their brain now means protecting their future, both on and off the field. Let's recap the 5 myths. 1. You don't have to lose consciousness for it to be a concussion. 2. You can get a concussion without hitting your head. 3. Symptoms can show up hours or days later, so keep checking in. 4. Pushing through isn't tough, it's dangerous. Rest is critical. Number 5, concussions are a big deal and they need to be treated with care. Let's talk about your role in protecting our young athletes. As parents, coaches, and mentors, it's up to us to replace these myths with facts. When we take concussions seriously, we help our athletes recover fully, protect their health, and ensure they have bright, successful futures on and off the field. If you ever suspect a concussion, don't ignore it. Get your athlete evaluated by a healthcare professional just like us who specialize in concussion management. At HealthFit Physical Therapy and Chiropractic, we are here to help. We're committed to keeping your young athletes healthy, strong, and ready for whatever life throws their way. If you have questions about concussions or want to learn more, just reach out to us. Because when it comes to protecting your kids' brains, there's no room for myths, only the facts.
Hey, if you found this video useful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for our latest tips coming to you every week. Share this video with your family and friends. It might just make their day a little bit better. I'll see you soon.